Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Modern dental practice depends greatly on effective dental auxiliaries. The selection of employees is an extremely important aspect of practice management. Here to discuss this selection process are Mr. Joe Consani from the University of Michigan, Dr. Barbara Weir, a private practitioner, and Dr. Ray Falasco from the faculty of the University of Michigan. I think our first question should be, at what point would someone decide that they actually need an employee? I wonder if one of you could be able to sort of respond to that.
Well, the first obvious situation is where you have a job vacancy and somebody leaves. I think it's natural for people to automatically think that they're going to refill the position, and maybe that's a good time to reevaluate whether that position is necessary in the first place.
I think that might be a good response for a situation, say, in a large organization like the University of Michigan, but if we were thinking about a private practice where you have a private dentist working, at what point do you think that person could determine, well, yes, I need to have someone else working in the office to help me?
That was a real problem that we encountered when we got out of school was, who do you hire and for what position? And we seem to have, we started with our initial staff and over the years have added and have had to redefine all of our job descriptions and kind of grow out as the practice grew.
So you determined that maybe you need a chairside assistant?
Right. We started with a chairside assistant and then kind of grew from there.
To be more specific, how would you determine the number of hours, for example, that you might need a person, whether it should be a part-time position or a full-time position or what?
We've always had full-time people in our office. We got to the point where when we were busy enough to justify another person, we were looking for a very career-minded person who was willing to go into it full-time and work those hours.
And you were able to identify a specific job description, for example?
Well, at each given time, we redefined our job descriptions and looked for a person to fit that description. And then as we expanded, we'd find another person that would fit the new job description.
Some dentists just sort of fly by the seat of their pants and just sort of hire someone. Do you think it's actually necessary to have a job description for a specific position?
Well, at this point, I say for sure it is. I know in the past we've kind of flown by the seat of our pants, and there were times where we didn't have job descriptions, and we ran into a little bit of problem later on. So I think it's a good idea.
I think, Bob, that it's particularly important because out of the job description comes the description of how you're going to post the position or advertise for it. And the key things you want to look for in the job are the key things that you want to include in your advertisement or in your recruiting effort.
I agree with that, and I also would add, Joe, that if you don't have a job description, you really don't know what to expect of the employee or what the employee expects of the position. So I agree that a job description is a very important item to have.
Is there any sort of a specific way one might develop a job description? I don't know, Joe, you've had some experience in terms of personnel. A person in private practice might not be familiar with this. How would one actually develop a job description?
Well, I think you want to stick to the basics first, and particular skills that are going to be required, the education, certification, or licensure. Some of those qualifications, of course, are essential. And I think it's important to keep a good priority in your mind as to what you want to have the person do. You don't want to include a lot of things like, do they make good coffee, if you're looking for a dental assistant. Obviously, the education and skills levels are the most important things.
Mm-hmm.
I think, unfortunately, it's very easy to fall into the rut of hiring a chairside assistant or a receptionist-type person, and it's very hard. I know we find ourselves always lagging in updating our job description. We hire someone and then try and rewrite the job description to kind of fit exactly what we want them to do. That's kind of an easy rut to fall into.
Joe, you mentioned advertising, and I think advertising for the position, I think this is an important issue. Does anybody have any comments in terms of how do you go about sort of advertising for a position?
Well, I think what you want to watch for especially is to be consistent. If you're going to list in an advertisement requirements for the job, you have to make sure that those requirements you list are relevant to the work that is to be done. And then you have to be consistent. In other words, if you're going to require a chairside assistant to be certified, then you can't later hire somebody who's not certified. Obviously, a lot of candidates would have screened themselves out if you had listed certification as a requirement. So you have to watch for that. And you have to list your important criteria and qualifications in the ad, and then follow through and be consistent in using that information in the hiring process.
Is there any way to prevent the extremes? For example, putting an advertisement in the paper and getting 400 people to apply, or by the other side of the coin, putting something into the paper or advertising and only getting one person or two people to respond? How do you really specifically hone in for the type of person that you actually are looking for through the advertisement, I guess?
Well, we have some very basic educational criteria that we use for most of our positions, but we also try and find the right person by putting a lot of motivation into the ad. We don't just list chairside dental assistant wanted. We want someone that's very career-minded, very motivated, and we tend to include very neat little phrases like, come join our team, or are you tired of not being appreciated in your current position? So we're looking for maybe not only the person that's out currently seeking a job, but maybe somebody's in a position that isn't really happy, that's looking for a better opportunity.
So a lot of times you're looking for a fairly skilled person in your particular practice. Is there any area in which you might not be looking for such a skilled person? I know in private practice sometimes people sometimes hire personnel right out of high school or untrained people. And so in that situation, you might not be looking for a very skilled person.
Right. Most of my assistants are all school-trained, certified assistants, but the people that I have working at the front desk are not necessarily. I have girls that have had just a high school education. Basically there I'm looking for someone that is really interested in working with the public and can handle all of the many little tasks that are happening at one time in the office.
You seem to be pretty well together in terms of knowing what it is that you want and how your office runs. I was just wondering if you can have some things to say for neophytes, if you will, for people who are still in dental school or who are recently graduates from dental school, in terms of what is it that they should prepare for in terms of hiring an auxiliary or just hiring anyone in the dental office. And you know, you can just take it from there, I guess.
Well, I think that that probably has been one of the biggest nightmares that we've encountered in private practice is the constant hiring procedure. It really is horrible. I mean, you're constantly spending your time looking for someone, trying to decide, will that person fit into my office? We often get people that are qualified that seem to meet the right skills, but we have a large staff, and trying to decide if that personality is going to click with the other people in the office, I think is the hardest part of hiring someone for us.
Could any of you speak to the importance of the hiring process, selecting an employee? Most people who are in professional school just feel like this is a complete waste of time, and what's really important is the development of the skills of the actual practice. And it's not relevant or not very important. You can just sort of advertise and hire an employee. It's very simple. Can anyone speak to the importance of that?
Well,
Brad?
I would say that if you don't get the right employee, in other words, if you're not advertising correctly and you go through all the various steps of interviewing, etc., and you still come up with a fairly subjective idea of what you want, there's no 100% correct way of getting the, in quotes, right employee. So you may, no matter what you do, end up with someone that just does not work out. This is why I feel that it's very important to have a probationary period where the employee can end or terminate the employment, or you as the employer can terminate the employee. I think this is real important.
Sure.
I think if I look over past several years, I think the biggest mistake that people make in an employment situation is they're not patient enough. As Barbara has explained, it's a very trying experience if you have to do it continually. People get frustrated in that situation, and probably the biggest hiring errors occur where people have not taken enough time to get the right person. The job may be open it's very inconvenient for that job to be open. There's only one applicant who's very marginally qualified, and so they take the person anyway because they want a warm body there to get the job done. And taking the time is just in the long run going to be well worth the effort.
There are a lot of pressures on you, though. If you're short-staffed, you just can't perform your job properly. And we're at the point now where I have enough staff to kind of cover, and we can stretch and cover ourselves. But there have been times in the past where if we were short one dental assistant, you were really overloading everyone else, and it's very, very difficult to ask everyone to work the extra hours, to go the extra mile to do it. And I know that in the past, I think we've been more likely to hire someone that wasn't qualified.
We'll be right back with our guests after this management fact. We'd like to talk now about obtaining credentials, such things as a job application or transcripts and things like that. I wonder, Joe, if you might be able to comment on that.
I think clearly one of the most important aspects of the whole hiring process is the application form itself. The problem is that many private practitioners don't have a standard application form. They may rely on individual resumes or just verbal conversations, and it's extremely important that they have a standard application form that everybody fills out, and that form be screened so that you're not asking a lot of illegal questions. It also serves as a guide then as to what kinds of questions you can ask in an interview.
Barb, do you have a specific type of application form?
We have a form that we've designed over the years, and it's actually two-part. The first part asks the basic information. The second part is a checklist of skills that the dental assistant has, or whatever job we're interviewing for, and it has a list of jobs, and it asks whether they perform these functions routinely, occasionally, or not at all. And we found that very helpful.
I was kind of wondering how you would handle an application. For example, if you put an ad in the paper for a dental auxiliary and you get various responses, maybe to answer to a box number, etc., do you send all these people an application form to respond?
We generally don't use a box number. We generally take the initial respondents over the phone. We do a little bit of initial screening to make sure that unqualified people aren't coming into the office. And then the applicant comes to the office, fills out an application form. If they look promising, then we will interview them at that time, kind of go through all of the promising people, and then invite back for second interviews the people that we consider at the top of the list.
Joe, you mentioned there are some things that you cannot ask, and I think that would be important to emphasize at this point.
Well, I had to make a list of those and to write them down because it's getting longer all the time. But at the present time, you obviously cannot ask for race or sex or color, religion, national origin or ancestry, whether they're handicapped, or of Vietnam-era status.
I don't want to sort of mess you up, but I want to jump in here. I know most dentists, when they interview, say, well, are you married, are you pregnant, and do you have a car? And I'm just wondering, whether those kinds of questions are legal. And they also ask, well, are you going to stay in the area and you're going to move away in the next 6 months, and what does your husband do? Are those legal questions?
They may be legal, but they leave you open to problems later on. If you keep in mind, basically, to ask questions that are going to be relevant to the job that's going to be done or the work that's going to be performed. How relevant is it whether a person is married or not, or whether they have children or not? Whether they have small children may depend upon their attendance and so forth, but as far as the work performance, you cannot categorize people, and that is a bias towards people who may or may not have problems later on in the working situation.
If I were interviewing someone and I asked them whether they had children or not, and they said yes, and I went ahead and did not hire that person, could I be in trouble?
Yes, I think so. It certainly would leave you open to problems later on if a person chose to make a case of that kind of a situation. Chances are in the private sector, you don't see much of the looking over the shoulder on the interviewing process and the hiring process as we do in public institutions and city governments and so forth. There's a great deal of a review of that whole process. The private sector has been somewhat immune from that, but there's a lot of evidence to suggest that those kinds of reviews are now trickling down to the private sector as well, so people would be well advised to pay attention to some of those kinds of things.
What about references? Are those important to follow up or to have even? And do you do that in your own practice?
We have always asked for references, and I think this has been one of my big bones of contention, is that every time I follow up, I can't really depend upon the response of, say, another dentist. Unfortunately, what one dentist considers valuable skills for an assistant is not necessarily what I would take in my office. And I've been very disappointed in the past with the response from other dentists. We'll call and get a raving recommendation, and we get someone in our office, and they're just not going to fit.
Do you think it has something to do with maybe that other dentist wanting to get rid of that dental assistant? So
or get them off of their unemployment roll? Sure, I do. I really do.
Or it could be that possibly the dentist that is called and is supposed to give a reference for an employee doesn't want to say anything detrimental in regard to this employee, again, thinking that they may get into some kind of difficulty. So they're very hesitant to say anything that would in any way be detrimental to an employee, and especially in writing. I don't think it's a good idea to try to get any kind of or check references and have it in writing. You may get a little bit more verbal information than you do in writing.
We ask on all of the previous employers whether or not we may contact this person as a reference. And certainly if someone responds no to that question, then we'll question them a little bit about why, what was the problem in that office. You may find an assistant that is top-notch but had a personality conflict with a previous dentist, and I don't think that necessarily disqualifies them as an employee.
Where would you put the category of references? Are they important? Do you sort of look at it sort of with a caution?
I always look at it with a caution. I've found that I haven't been happy with any of it. In fact, another point is that I've contacted a number of teaching institutions where these people have gone to school or have worked, and I very often get another biased opinion that, oh, well, this is an excellent graduate of our program. You get them in the office, and boy, not for us.
Joe?
I think this is an area, though, that pays to take some time. Okay, it's a time-consuming process to check all those references, and if you have 15 applicants, I wouldn't start checking references on all 15 of them. I would narrow the field down to about 3 or 4. But I'm always amazed. Problem employees that come up. I go back to the application and I can predict there's information in there that should have told us, that something was going to happen. And, obviously we didn't do a good job of checking references. Another thing people seldom do is verify education by asking for a transcript or calling the college or something like that. Did they get a degree? Are they certified? And the other thing that I think you want to have on the application form itself, and here again is another reason why you should have an application form, because you can have the statement on there, do we have permission to verify with previous employers and get references? Also, you want to have a statement down the bottom that says, I hereby certify that these statements are correct and that incorrect information could be cause for dismissal at a later time or something like that. To cover yourself, people pay much more attention than to giving you more accurate information. As far as references are concerned, I think although it's a time-consuming process, it may not help you in all cases, but I think in many cases, as Ray said, to get somebody on the telephone, you can pretty well tell where you have a problem or not.
Well, this may be true in the private sector, though, because you're dealing with professional personnel managers or people that are used to hiring, but I'm not sure that it is true talking to other dentists.
So we're really talking here about trying to interpret and examine these credentials that we've asked for. And I guess we'd all have to agree that we have to look at them very carefully. We have to see that they're complete. And we also have to perhaps look at them with a jaundiced eye, perhaps, and not take them at face value.
Another thing is to find out how many there are. So if a person has changed jobs every year, they have 15 job references in the last 2 years, that in itself presents and should be a key to you. And there, I think, an important question to get at is, why did they leave their previous job? They may state one reason, and you may phone the previous employer, and the previous employer may give you a different reason. You know, and that tunes you into a special problem.
This now sort of leads us into the other area, and that is how you would decide if, in fact, you need to interview this particular candidate, or how you decide which ones you would interview. So how would you go from this point, from gathering the qualifications to say, okay, we're going to interview this particular person? Any comments?
Well, I think probably what you would do, and what I think most dentists do, is, as Joe mentioned, it's kind of a narrowing down process. You may have several applications, resumes. Looking at these and analyzing the qualifications of the people that are applying, you might narrow down to 3 or 4 applicants, the ones that look the best, and these you would bring in for an interview. And as Barb mentioned, sometimes even a second interview would be required. So I think it's a narrowing down from a large population of people applying to a narrower for 3 or 4 that you might want to interview.
And here again, I think an important part is the most relevant previous experience. How close was that experience to what your experience is going to be, you know, in your office? And if you can get good references there, you probably got a pretty good employee, potentially.
Thank you for your comments. Our guests today have been Mr. Joseph Consani from the University of Michigan, Dr. Barbara Weir, a private practitioner, Dr. Ray Falasco from the University of Michigan. We hope you'll join us for other programs in this series that are designed to assist you in achieving success in your dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.